Great. Hi, everyone. Thank you so much for joining us. My name is Michaela Johnson. I am the program manager with Big Cities Health Coalition, and we are excited to kick off our two-part webinar discussion about narrative change, specifically in the realm of violence prevention and community safety. Before we begin, I'd like to give a huge thanks to Prevention Institute, who has helped to co-lead this project. I would also like to thank our funder, the Kaiser Permanente Center for Gun Violence Research and Education, which is powered by the Health Alliance for Violence Intervention, for their support. As a quick housekeeping note, we have a few technical quirks on this particular meeting format. While meeting attendees are unable to unmute or come off a video, we do encourage folks to use the chat box to leave comments and ask questions throughout the presentation. And we will plan to go through as many questions as possible at the end. I will now pass the mic to our featured speaker today, Pamela Mejia, Director of Research and Associate Program Director at the Berkeley Media Studies Group.
Thank you so much for having me. It's a pleasure to be here. I see some familiar names in the chat. Hello. It's a real honor to get to be here today, talk about one of the things that well, it's not my favorite thing, because obviously a lot of what we're going to discuss is not the most optimistic, but one of the most interesting areas of research that I work in, which is really the stories we tell ourselves about firearms and firearm violence, and also safety, and what it takes to prevent violence and keep one another in our communities and loved ones, and the places that we live in and raise kids and work safe. So, what we're going to do today, if you wouldn't mind moving to the next slide, um, is first I'm going to just share a little bit about who we are at BMSG. And then I actually had another slide that's coming up, but I'll go, oh, thank you. I'll go through that briefly now. We're going to talk a little bit about the role of the news in shaping and reflecting narratives about firearms, as well as many other issues. I'm going to name and identify some patterns in news coverage of firearm injury and death, as well as prevention and intervention and healing. Going to talk about opportunities to lay groundwork for a new narrative about community safety, which is, I know, a priority of many folks in this space and on this call. I'm going to be talking quite a bit at the outset, but I have tried to include some spaces where we can have some discussion throughout the slide deck, because I think that, as we'll discuss, much of the information that I'm going to share today is, I think, things that people are very cognizant of in their own ways. So some of what my role is as a media researcher is really to just to concretize to some of the patterns that folks may have already noticed, for example, as consumers of media or as consumers of narrative. Um, I know that as was named earlier, there's some quirks of the platform. So I would encourage folks to please put your comments and questions in the chat. As things, surface, I will do my best to address them in the course of the conversation, but we will have some space at the end also for our more robust Q&A conversation. I'm also going to be sharing a lot of resources today. I will make sure to get those, if not in links to y'all in the chat in the moment. Sometimes I have trouble kind of jumping from between the slides in the chat. I will certainly be happy to share those afterward. So now you may be wondering, who on earth is this person? So if you wouldn't mind going back to the slide prior, thank you. So I can just say a little bit about who we are at BMSG and what we do. Some of you may be familiar with us and some may not. We're a very small shop. I think you're meeting about 10% of the staff today, if that tells you anything. But we have been around for over 30 years, and our focus is really threefold. As director of research, I'm in charge of all of our work around conducting narrative research, understanding how news and other carriers of narrative address public health and social justice issues, really with an eye towards understanding who's part of the story, who's absent, what solutions are named and aren't, etc. All of our research feeds really directly into the work we do training and supporting advocates to use the power of media and strategic communication just in general to advance the work that they're doing to make systems and communities safer, healthier, more just, and more free. We also work extensively with journalists, providing resources, connecting them with community members and potential sources, really just doing whatever we can to help journalists bring a public health perspective to their reporting, that to talk about solutions as well as problems, and to bring in perspectives that may not otherwise be heard. So if you now can move ahead 2 slides, there we go. Perfect. So, a question that we used to get a lot of, I think we get less of it now. Certainly in the last 8 or 9 years, we've gotten it less, is, well, why the news, right? Why is news such a focus of the work that you at BMSG do and have been doing for the last 30 years? I should affirm, I have not been at BMSG for 30 years. I've been there for 15, during which time I have been primarily focused on, again, understanding media narratives about different public health and social justice issues, most specifically different forms of violence and harm. And the reason that the news is my focus and our focus at BMSG is really because the news plays such a key role in shaping both, what we're thinking about and what we're not thinking about. And it also influences things like how we're talking about solutions, what solutions we see as viable, whose perspectives we see as having credibility, or whose we may be, inclined to overlook because they're not being part of the being, made a significant part of the conversation. And we also know that news doesn't just reach us as the general public or the voting public. It also reaches decision makers. It really has a tremendous capacity to influence people who are in a position of power to um, make decisions about the kinds of, the policies and the systems changes that influence our lives. So at BMSG, really our thinking is, if we want to be part of shifting and adjusting policy and supporting, changes that can affect whole communities, we need to be part of what voters and policymakers are paying attention to. And even still in this age of social media, that is very often the news. So that's why for a lot of the conversation today, when I'm talking about how we understand narrative, I'm going to be using the lens of news coverage because it gives us a really good window into kind of the conversation as it's unfolding, what's present and what's missing. And so, a question I often like to ask folks, one question that really guides all of our research at BMSG is, if you move to the next slide, if people only knew about an issue from the news, what would they know? And perhaps more importantly, what wouldn't they know? And that's I think, an important organizing question, because we know for a lot of people, especially if they don't have firsthand experience with an issue like violence, the news is kind of what they know. It does really set the tone for their understanding of the issue and their understanding of what's possible and not possible. So I've been talking a little bit. I know folks can't unmute, but if people want to, I always like to ask this question. I said partner up, but you know what? Let's not partner. Let's just use it as a shared conversation. I would love to hear folks' perceptions of or responses to this question. If all anybody knew was about guns, gun violence prevention, in your community came from news coverage, what would they know? And what importantly might not they know? So I'll give folks a moment to think, and if you feel inclined to put your comments or your thoughts in the chat, please do. I know that that's a big question, so give people a minute. Mm. I think that's a great question, and I really appreciate you naming that, Jenka. News cover, a lot of the news that we'll be talking about today, the coverage that we've been able to evaluate is more mainstream traditional news, so TV, print, radio, and online news. Social media is a really important determinant of how people think about issues and shaping their understanding. We can talk a little bit about why social media research isn't as big a piece of the work that I and other media researchers do. But I would say you could include social media in your responses to this question. So some of the responses I'm seeing here is that they believe that there's nothing we can do about violence. They would know that it's a contentious issue. Ooh, lots coming in. That only Black people are violent in their community. Whites are killing more students in the school, military style guns. I'm just reading what I'm seeing. That it's not the right time to talk about solutions. The belief my neighborhood is violent. I live in Oakland, California. Mark, I hear that a lot. Reinforcement of racial stereotypes, that there's too many guns in the community. that people are being killed, including children. Again, so lots of that people are. Here's another point: people might only think that mentally ill people with mental illnesses commit violence. Um, the quote, "Let's hope it's not on our side," etc. Oh, so Nicole, this is an interesting point. I'm not sure if that's something that people would know or not know, but that there has been a 50% decrease in gun violence in your area. That's incredible. As we'll talk about, sometimes those successes don't necessarily get named. Um, People would get a false view about Black people. Some news refuses to tell the truth. There's definitely, I think that's a really robust conversation about, the trustworthiness of news. Again, that's a thread of conversation that's picked up a lot in the last few years. Um, they wouldn't know the true reality of firearms in the community because media coverage is skewed. They would probably know about shootings, arrests, and crime stats. They wouldn't know about root causes like poverty, disinvestment, and trauma. Great point, Raimundo. That men commit most gun violence. That's from Jordan. Um, National would tell a different story. I think that's a great point, Nicole. Feel free to, contribute thoughts on the national conversation as well. They wouldn't know about policies to prevent further harms. They wouldn't know that there's something that they can do personally. I think maybe getting to that point that folks were naming earlier about that sense of futility, that this is just something we must bear. They would also not see resilience, healing work, and prevention strategies that a community is leading. Phenomenal point, Raimundo. Thank you for it's like you're my plants in the audience. These are such great, all of you are. These are fantastic points um, about kind of what gets lost. They wouldn't learn about violence reduction. There's a hype at violence without looking at the stats showing significant reductions. Thank you, Jenka. I think that might get to the point that was raised earlier about the reduction in gun violence that they meet. That might be something that's getting left out of the conversation. So phenomenal points here. People have and I think I'm assuming from based on the conversation, the question that came up earlier, that this is informed both by traditional news as well as what people are seeing and hearing on social media. Again, in my and other people's work looking at social media as a carrier of narratives, I would say a lot of the patterns that we're going to discuss are carried out there, but they're almost they're magnified just by the sheer volume of content and the specificity with which it can reach its audience. So we'll come back to that point. Well, so I think the biggest thing that I can now say is that a lot of what I'm going to say in this space is not going to be brand new information because as we've seen in the chat, people are very familiar with some of the nuances of what the dominant narrative around guns in community is. So consider what I'm going to say today as hopefully an affirmation and as something that perhaps provides some additional data points that can help round out the perspectives that we have as individual news consumers of media or news and media consumers. So, a few points that I want to highlight. And again, I'm hoping that we'll have some robust time for questions. So, I'm going to hit some high points and then we can, dig in further. But again, do please put comments and questions in chat as well. So, the first point I want to raise about the dominant narrative is that media attention to all forms of firearm injury and death is high, particularly in the incident. In the aftermath of a high profile incident. Mark, great point. By the way, I'm going to come back to that in just a moment. Um, so if people only knew about the news, about guns from the news, what would they know? Well, they would know that guns are a big problem. They would know a lot about violence and harm from firearms. If you move to the next slide, we can see this is just a study that I did. Calling it a study is a bit ambitious. This was just some quick research I did 2 days ago. Um, that was looking at just news in US news and online outlets in the aftermath of the Charlie Kirk and Evergreen High School shootings earlier this month. And you can see even in this very restricted sample, coverage rises very, very markedly in the immediate aftermath. And that's echoed over the years. I've done studies of news about in the aftermath of the Las Vegas shooting and others, Media Matters, and other organizations have also done these analyses. They found that over time, after a a high profile or a mass shooting incident, coverage tends to stay very high. It used to be for up to 8 days. Now the window has tightened, and as you can see here, it's more like 3 or 4. Where there's a lot of attention to firearms in the immediate aftermath of that incident, but then it begins to dip down. Which again, I think, as we'll name in a moment, really when we get to that question of what would people know and what might not they might not know about the true prevalence of, for example, firearm injury and death that is not related to a very high profile incident or a mass shooting incident. So if we can move to the next slide. I think this is a point that's been raised, and folks like Mark and John and other folks in the chat have been raising this point that the news, when stories about firearm injury and fatality do appear in the news, they tend to focus on issues of either, again, mass shootings or high profile incidents or community level violence like assaults or murders that happen outside of the home and in community. Whereas incidents like domestic violence involving firearms or firearm suicide tend to be dramatically underreported. And if we can move to the next slide, we can see some of this borne out in the research that Berkeley Media Studies Group has done. This is just one comparison between two analyses that we did about 5 years apart, one in 2017, one in 21, so I think it was actually 4 years apart. And this is a really representative of what of a couple of different patterns. So again, 2021 was a little while ago, so some of these are not as stark as they might have been. Some of these jumps are not as stark as they might have seemed a few years ago. But you can see that community violence dominates the coverage, and police violence as well. But officer-involved shootings were a particular source of coverage in 2021 for obvious reasons relating to the national landscape. But across the board, community violence, community level incidents always draw more media attention than do other forms of injury and fatality from firearms. You can see that, for example, firearm suicide is reported on significantly less frequently, as is domestic violence. So, as I often remind people, we can't solve a problem we don't know is happening. So, one of the questions or considerations that I think that we as people thinking about narrative are all thinking about on this call and elsewhere is, well, do people really have a full picture of the scope of what of the kinds of harm and the kinds of violence that are committed by firearms and the kinds of solutions that are in place or need to be in place to address those kinds of violence and harm? And again, as we can see, there are some really significant and stark differences between how community level violence, again, assaults and injuries that take place outside of the home, often committed by people who are not related to each other, those drive a lot of media attention, whereas other kinds of violence that may be actually much more prevalent are significantly underreported. If you want to move to the next slide. A third kind of nuance that I want to dig into a bit here is really around framing. Framing is a term that gets used a lot, and there's a lot of different contexts. There's a lot of different ways that people define and talk about it. And what I really want to talk about when we're here together is around this idea of news frames, right? How do news stories present and characterize the information that they're presenting? And if we move to the next slide, we can see that overwhelming amounts of research, my own included over the last 15 years, really demonstrates that news coverage overwhelmingly follows a pattern that we might call a portrait. So news tends to focus very, very narrowly on the details of a specific crime. Right. And so we can all imagine that, especially when it comes to talking about violence. Right. Although this is true across issues from housing to food justice to violence and crime. We know again that stories about violence and other issues tend to be framed as portraits. That is, they're very narrowly focused on a particular person or a particular incident. So they tell us a lot about that one person or that one incident, but they don't necessarily tell us a whole lot about what's happening around it. So what gets missing is some of those pieces of context that, for example, folks were naming in the chat: root causes, resiliency, solutions, etc. What we see far less often are stories that are framed more like landscapes, right? So landscapes might talk about a particular incident or a particular person, but they also give some background so that you can see the context in which that incident is happening or which that person is living. And the reason that we care so much about portraits and landscapes is because we know from decades of media research, as well as perhaps our own lived experience, that when people see stories that are framed like portraits, and then they're asked, well, what caused the problem? They say well, that was just a bad person, or that person just made really bad choices. They really default to thinking only about personal responsibility, both as the cause of and the solution to the problem. That's tricky because that doesn't leave a whole lot of room to talk about things like solutions that go beyond punishment, that go beyond criminal justice, that go beyond just moving bad people away. The good news is that when people see stories that are framed like landscapes, even though those stories are rare, they are more likely, when they're asked, well, what do we do about this problem? To start talking about solutions that go beyond the individual, to start talking about solutions that encompass community, that encompass systems and structures, that are about not just individuals making better choices, but also about systems and structures being in place so people can make those better choices, or so that people can have the lives that they want and deserve to live. So let's go to the next slide. I think this is all very theoretical, but let's get kind of zeroed in here. So we can all imagine a portrait story. The overwhelming majority of stories about all forms of gun violence are framed like portraits, and they zero in, as I said, very narrowly on one particular person or incident. Again, about 80% of stories about any issue, including issues involving firearms, are presented as portrait are framed like portraits. So 80% of stories about firearms tend to be these very narrow portrait stories that in turn don't necessarily help people think about context, about root causes, about solutions. Only about 20% of stories are framed like landscapes. So again, they may talk about a particular incident, but they nest it in the larger landscape of things like data, of things like solutions, of things like talking about root causes and preventive factors. And again, those landscape stories are more rare, but they are important because when people read or see them or consume them, they are more likely to then start thinking about bigger structural and systemic changes that can prevent the problems that were being discussed or that may have led to those problems in the first place and that require intervention. So I know this is a lot, but if you remember one thing of this, remember that kind of the dominant landscape, the dominant narrative around firearms is a series of isolated portraits that highlight individual incidents and don't leave a lot of room for conversation about anything beyond the details of those incidents of who hurt whom, where, and when. So if we move to the next slide, I want to lift up that this is not just research from, I've mentioned media researchers have been digging in on this. And one of the things I'm hoping I'm able to do today is introduce folks to the incredible breadth of research beyond my own. I'm a very small fish in this pond of folks who are doing incredible research to document um, how we tell stories and how the media tells stories about guns and violence and harm and prevention. This is from some work done by Jessica Beard, a friend and colleague based in Philadelphia with the Philadelphia Gun Violence Reporting Project, where they've really begun to zero in on, well, what do we want to see in that landscape? What is a public health story about news story about firearms, about guns and violence look like? And what's part of that story? What's part of that landscape? And these are some of the features that they've identified as key. And again, being very clear, this is Jessica Beard and the Philadelphia Gun Violence Reporting Project's work, which is just phenomenal, and very happy to talk more about my understanding of that work. I'm seeing them next week and very excited to learn more about their findings. But again, these are kind of the things that we would perhaps want to see in a landscape story about firearms and injury. But if we move to the next slide, my research and research from Jessica and others really illustrates that what tends to get left out when you zero in on that portrait and lose the landscape is a couple of things. We tend to lose solutions, right? So my and other research really illustrates that when news stories about any and all forms of firearm injury and fatality appear, solutions very rarely appear. There's often a mention of a criminal justice consequence, somebody got arrested or is being held. But in terms of solutions, the kind of community level work that we would like to see happening, or really any kind of solutions, we're not seeing them very often in the news. So if people only knew about firearms from news coverage, what would they know? What wouldn't they know? As folks named beautifully here in the chat, they might not know that solutions are even possible. We also know another thing that gets kind of left out when we zoom in on that portrait and lose the landscape is the discussion of things like those contexts, the root causes, the consequences, those public health, those kinds of components of a public health picture that tend to get lost when we zoom in on the picture on the portrait. And again, folks named here in the chat this very same thing, right? A lot of issues like the root causes that make violence more common, some of the consequences that go beyond just an individual to reverberate for families and communities, those get lost, etc. And finally, a really important thing that also gets lost when we zero in and we're focused on those portrait stories is who gets to be part of the story, who gets to tell the story. And what we know from my own and other research is that a very narrow range of speakers gets quoted in news about most forms of firearm injury and fatality. So let's dig more into that because I always think it's important to think and talk about who gets to be part of the story. My daughter's obsessed with Hamilton and she always says the who lives you who dies who tells your story business. So that's what's always running through my head when I talk a little bit about speakers in the news. If you want to move to the next point. So the dominant narrative about all forms of firearm injury and fatality is really carried by representatives of the police and the criminal justice system. My and other research demonstrates pretty resoundingly that police and criminal justice speakers are most often quoted when news stories show up about any kind of firearm injury, fatality, or even on a limited occasion, prevention or intervention work. So if we move to the next slide, and this slide is not, I apologize, this is a little bit tricky to read. There's a lot of content on here, so we can walk through it. This is from a paper that I wrote some years ago. I'll share the link at the end called More Than Mass Shootings, Media Narratives About Firearm Violence in California. And this was a project where we looked, in fact, at all news coverage of all three different kinds of issues that we've chatted about today, right? Community level violence involving firearms, domestic violence involving firearms, and firearm suicide. And we really tried to look at how coverage played out across those issues. And there were certainly differences, but overwhelmingly and across the board, we see that criminal justice representatives dominate the coverage, particularly when we're talking about news about community violence, which, as we've already established, is the most commonly discussed or most commonly covered kind of violence in the news. So, who gets left out? Well, we see some of the voices who aren't necessarily present include people like victims or their representatives, members of communities, including community-based organizations, representatives of the government who may play a role in bringing, for example, intervention, prevention, and healing programs to scale, representatives of advocacy and activist groups who are working on making communities safer, again, pretty absent from the coverage. Researchers, largely absent, or representatives of, across the board, although that does tend to be in when coverage of firearm suicide does appear, researchers do tend to be far more present in that coverage. You can see that health and mental health, folks who are representing health or mental health, or indeed public health, tend to be largely absent from coverage of different kinds of gun violence and firearm suicide. Again, lots and lots of different folks that you can see on this list who we know do play a tremendous role in building and maintaining safe communities, but they are not part of the news conversation. So again, getting back to that question, what might people know and what might not they know? Well, they might really not know that other actors than police have a role in addressing violence, preventing violence, healing trauma, and making communities safer. If you want to move to the next slide, this research is also borne out, as I mentioned, in lots of other ways. And I want to lift up some of the amazing work from the Philadelphia Gun Violence Reporting Project. In a recent study that I had the privilege of reviewing that I really recommend folks take a look at if they have a chance, called Like I'm Nobody, Firearm Injured People's Perspectives on News Media Reporting About Firearm Violence. The team also found that, again, none of the participants that they talked to were interviewed by a journalist about the shooting that they experienced. And instead of gleaning information from interviewing firearm injured people, journalists likely presented information collected from police. So this is, again, the same finding, but represented through a slightly different lens of actually talking to the folks who are themselves or were themselves victims of a shooting, and their own experiences of being ignored or left out of the media conversation about their own issues, their own incident. And here I do want to lift up that there is some great work happening, and I'm, happy to discuss it more. It's not something I know as much about, but there are some phenomenal examples of violence interrupters and victims of violence organizing to address issues like community violence in the media. The Philadelphia Center for Gun Violence Reporting, for example, hosts the Survivor Connection, which is a resource to support survivors of violence in connecting and communicating with media, and also provides training, et cetera, to support folks in their journey of becoming authentic messengers for media reporters, for journalists. So again, yes, and then I also wanted to name this a final piece of the coverage that I think connects and is not going to be a surprise to folks based on our conversation. But this is an interesting nuance that I want to dig into a little bit, and I wanted to give it some breathing room of its own. So, as folks have named in the chat, the news overrepresents Black and Brown people in stories about violence. So, how do we see that? Well, if we move to the next slide, this is research I've been privileged to do. These are images from from the analysis that I named, More Than Mass Shootings, where we looked again, this is at California news, but California is a big state, and I think that we've seen over the years that many of the patterns that we saw are represented elsewhere. When we looked at media coverage, particularly of gun violence of domestic violence involving firearms or of community violence involving firearms, the coverage was very distorted. The portrayals were very distorted. The majority of images of people in our sample were presented as people of color, as Black and brown men and women. The majority of people accused of crimes pictured were people of color. They were most often featured in their mugshots. There has been work to stop newsrooms from using mugshots in recent years, but when we did this study, that was not the case. Um, in stark contrast, people who presented as white, the majority of whom were white men, appeared primarily as representatives of the criminal justice system, rather than either as victims or perpetrators of violence. So again, the pictures you're seeing here are fairly typical of what we would see when we saw stories about their various kinds of firearm injury and fatality, but especially community violence showing up in the news. Um, as I have joked, or not joked, but as I've said in the past, if a picture paints 1,000 words, the picture that's being painted here is one that really distorts how Black and Brown communities experience and show up in conversations about violence. This is perhaps not surprising news, but what might be surprising is the next point. So if we want to move to the next slide. So even though when news about community violence shows up, Black and brown folks are overrepresented as perpetrators, especially. In general, when we look at what kinds of shootings generate media attention, violence that happens in Black and brown communities and low-income communities tends to be underreported, while violence that happens in affluent or majority white communities tends to generate significantly more attention. So if we move to the next slide, I'm going to give a couple of data points, which again are from colleagues in the media analysis field whose work I strongly recommend if this is of interest to you. I first want to lift up the Media Accountability Project conducted by Corners Research Lab at Northwestern University. They found that the media, quote, prioritizes and contextualizes gun violence incidents in majority white neighborhoods in ways not seen in communities of color. So, for example, they found that even though 63% of gun violence incidents occur in communities of color, an incident from a majority white neighborhood was 50% more likely to receive national media attention than a comparable incident in a community of color. Similarly, if we move to the next slide from my friends over at the Philadelphia Gun Violence Reporting Project, we see that reported shootings that generated reported media coverage in Philadelphia tended to be concentrated in higher income areas. And some of those shootings actually received coverage in multiple news stories, while shootings in, for example, areas with a lower reported income tended to generate none at all or were completely overlooked. So again, the citation for this is here, but I think that this image is very striking. So again, it's a bit of an interesting tension, but one worth considering. That again, when stories show up, they tend to overrepresent Black and brown folks as perpetrators of violence. And also, in general, if you look at the aggregate, stories about violence in communities of color and low-income communities don't tend to generate that much attention and are passed over in favor of stories about more rare shootings in affluent or majority white communities. So I think that that's just a nuance worth naming, that I think also folks in this conversation that we were having it in the chat also kind of spoke to some of that tension and some of those disparities. So what is this all? One last thing I just want to name is narratives about firearms, and this is, I think, something that doesn't necessarily come through in the news coverage, but it does come through in other kinds of narrative work that I've done, including public opinion polling in different states, including California, but elsewhere as well. That I and others have done that shows that when it comes to firearms, there's obviously a very dominant narrative. We've seen a lot of the nuances of it just in this conversation. And also, people are hungry for solutions to make communities safer. When you test with different communities and groups about what kinds of solutions they want to see, it's hard to find one that stands out because people want everything. People say, yes, absolutely that, and yes, that, and yes, that, when it comes to talking about solutions, including solutions that they may be less familiar with, like community-based or community-led efforts that go beyond the criminal justice system or national gun violence legislation. So I do feel like that's always a point worth noting when we talk about narrative is that there is this other piece, which is the narrative is overwhelming and can is very negative. And also, one of the ways that people respond to that narrative is with hope and eagerness for learning about and making the case for other kinds of solutions that can make communities and families safer. So moving to the next slide, I just want to name a summary. There's a couple of bullet points here. One, the media focuses on portrait stories about isolated incidents and criminal justice framing dominates. Context, consequences, and solutions are absent. News coverage paints a distorted picture of who experiences gun violence, but audiences are really hungry for innovative solutions that can make communities safer. And we know this again through pretty robust public opinion polling around around states and the country. Okay. So that's a lot. Let's talk a little bit about what to do about it. And the first thing I want to name before we go any further is that I know that what to do about it is a very big question. It's a question that there are now more than ever much bigger factors than any one person or one organization or even one network can accomplish when it comes to changing how we make media, how we tell stories, how we think and care about each other, how we reckon with our country's history of systemic racism and oppression, etc. So the things that I'm about to talk about are not things that can do that, but they are strategies, efforts, and activities that can kind of, for lack of a better term, keep the lights on, right? They are things that can help us keep moving forward as we grapple with the big picture, large scale things that need to happen if we are to ever not only change our narratives about guns, but change how we relate to guns, how we treat guns and each other in our country. And I also want to name that what I'm going to talk about, even though it isn't necessarily, it isn't going to be, things that can help us end capitalism and start all over again. There is always value in thinking about shifting media narratives because shifting media narratives can, even in the short term, play a role in disrupting what's called mean world syndrome. So if we move to the next slide. Mean world syndrome is was developed by a communications professor named George Gerber in the 1970s, and it's been heavily validated since then. And mean world syndrome describes how very heavy consumption of of violent media content, actually media content in general, but violent content in particular, can lead viewers and news consumers to perceive the real world as far more dangerous and hostile than it is. So again, the more media you can consume, it's kind of a dose response relationship that we get to see in action. The more media people consume and the more violent media people consume, the more dangerous and scary and unstable they perceive the world around them to be. And we can infer they probably make a lot of their decisions based on that assumption. So even if part of what I talk about and what we work a lot at BMSG with around is this idea of what does it take to interrupt mean world syndrome, to create something that can interrupt the flow of information that convinces people the world they are living in is violent and dangerous and scary beyond what is actually true about it, their community. I see. Oh, sorry, I saw a question, but that's it. So, and I think that this comment, all again from the paper I mentioned, like I'm nobody, does a really good job of encapsulating some of what the impact of mean world syndrome is. This was a shooting victim who talked about his experiences with media coverage and affirmed media coverage comes down to it's a guy who got shot, the city is violent, that's what goes on. Expect this every day versus we have to stop the violence in the city. It's just routine. So again, I think as often when I often think that quotes from people who are most directly impacted can really help crystallize some of what we're talking and thinking about. And I think this quote does a great job of illustrating what how mean world syndrome plays out. It plays out with the idea that well, the city is just violent and scary, and that's just we have to deal with it and make our decisions accordingly. So a few things that I really, work with and encourage folks to consider and think about, particularly in this space, and as we're reflecting on what we can do, not only to shift patterns in media coverage, interrupt mean world syndrome, and again, kind of keep the lights on as we are part of the larger work that needs to happen to shift not only narratives but shift how we to shift our cultures and communities. There's a few things that I wanted to lift up that health departments or folks in health departments can do. So if you want to move to the next slide. First of all, I really encourage folks to think about expanding the frame, bringing the landscape forward. Public health folks, we're really good at that, I think, because we have a lot of strengths in the public health world to draw on. Things like history, facts and data, including facts and data that aren't just about what's lost, but also facts and data about things like quality of life or other factors that can illustrate a different that can broaden the frame around violence. Are there social factors or root causes that can be named? Are there other perspectives that we want to make sure to bring forward that perhaps as a health department we're not the right voice for, but somebody in our network or in our community or our neighborhood, in our networks might be the right person to be part of the story and to help expand that frame. Um, I want to name too that we're seeing some of this in action. This is not a resource I'm as familiar with, but I know that, for example, the Los Angeles County Public Health Department has resources like Violence, Hope, and Healing in Los Angeles County, resources that are really designed to help people pull back the frame and bring in some of the factors that can help illustrate the landscape in very specific context, in this case in Alameda County. That's just one of the resources I'm aware of, or excuse me, not Alameda County, Los Angeles County. That's just one of the resources I'm aware of, but I know there are many others, and perhaps this space can be also kind of a co-learning or a resource sharing space to think about some of the resources that are out there to help and support folks in public health spaces as they're doing that work of bringing public health resources forward to expand the frame around violence. If we move to the next slide, I did also want to name as we're thinking about other perspectives, thinking about building, narratives through partnerships. This is, this is the framing that was used in one of the reports that I saw from the hobby that I really appreciated. That talked about the possibilities of things like, really working with folks in community who can say things that perhaps health departments cannot, or can give a different voice to both a problem and a solution. When we at BMSG work with health departments, we work a lot on supporting them in doing media training and sustained support for community members so that they are more empowered to speak with the media. Um, and also that they have the supports they need, not only the physical supports like childcare or help getting to an interview or a meeting, but also things like just kind of some of the supports that are needed to do practice and train and be prepared to talk to media. I also wanted to name that, building narratives through partnerships, an important role that health departments can play is connecting reporters to community members so that reporters then have a more robust um, uh, portfolio of folks to go to in conversations about violence. A lot of times when I talk with reporters about violence reporting, they say, yeah, well, the police pick up the phone when I call. I don't know who to call in community. I don't know what advocacy network or group that I should contact. So I just go back to calling who I know will pick up, which is again the police department. So I do think that, we've seen it in parts of, especially in parts of California and Missouri, where we've done some really intensive work, that we've been able to see health departments playing a really great and key role in helping connect reporters to community members and to advocacy and local community organizations, so that again, reporters have more folks to talk to when they need to do reporting on a story about violence. Um, we're getting close to time, so I'll just say, a third thing we always say, if you've ever seen anything from BMSG, is that we always encourage people, even though it feels harder than ever right now sometimes, to articulate shared values and elevate, potential for hope and healing. As we've talked about, the dominant narrative around violence and firearms is one of fatalism and futility. There's just too many problems. What are we going to do? And there's nothing to be done about them. A lot of folks named that in the chat. And that again is a huge contributor to mean world syndrome. So if you want to click again, there were some great values pieces that emerged from, for example, some of the report summaries that Javi has been putting together around values like safety and care, shared responsibility, common sense. This is a value a lot of people don't necessarily feel comfortable or like remember that they can go back to. But there's a lot of data that we have as public health folks that can illustrate why some of the solutions and interventions that we're talking about do make good sense in terms of keeping communities safer, reducing costs, et cetera. That's a value, and that's something that we can lift up and name um, in our remarks or in the remarks that we support our community partners in making. Self-determination, transformation, resilience, and belonging. Again, these are all different values that were elevated as really key in, for example, the final reports, the report summaries that I've seen from Javi relating to some of this work. And that, again, I just want to lift up because I think they are strong ones, they are important ones, and they are ones that can help, again, uh, motivate, they can help kind of break a little bit of the doom loop that tends to surround narratives around, especially as we've seen firearm injury, fatality, and what prevention and intervention can look like. And finally, because I want to make sure we give some time for I just wanted to, if you want to move to the last slide, I just wanted to name one other thing that we always work with folks on and encourage folks to do. It's especially hard as a public health person, I know, as a public health person for myself, is speaking plainly. And so a few of the things that we talk about, this was actually from a training we did where folks in public health departments were putting up all the different pieces of jargon that they use in a single day. Um, and I think, as you can see, there's some here that I know, there's some I don't even know. But we really encourage folks. One of the things that we've heard and experienced a lot in talking with and working with folks on narrative, changing narratives about violence, is that people are changing narratives about violence or have the capacity to change violence about narratives about violence every day. But sometimes they feel like they have to have a certain degree or credential or vocabulary to do it. And I think when we can kind of democratize and demystify our language and kind of create a bigger tent in which people can see themselves and their work as parts of violence prevention efforts, we're going to do better, and we're going to be bringing more people, more people into the work who, again, are hungry for solutions, are hungry to be part of making communities safer, but may not feel like they can do it because they don't know what all these words mean. Or they don't know what all these acronyms mean, or they don't necessarily feel like they have the academic language of violence prevention. The other thing I always name or suggest when it's talking about violence, if possible, is, and I think many folks do this, but I like to say it just for my own peace of mind, is when possible thinking about using person first language. So talking about person who commits crime, a person who commits a crime, a person who's involved in the justice system, a person who experiences violence, etc., versus an offender or a victim or a perpetrator. The reason that, it's always, I always think about that, and I think that's an important practice, is a couple of things. One is that it's really hard to think and talk about intervention, whether it's prevention or intervention, if you're talking about somebody who's being characterized as just sort of a monster, or somebody who's just sort of essentially uh, other, right? Essentially, a perpetrator, an offender. It's a lot harder to talk about intervening on behavior. Whereas, really, if we're talking about a person who commits violence, a person who pulls a trigger, a person who's involved in a shooting, etc., at least there that does leave some room to talk about an intervention and a point of a point of intervention, in a way that essentializing people and kind of talking about them as perpetrators or offenders, for example, might not. We also know from a lot of the work from Philadelphia gun violence and other places that a lot of the reporting on people who experience violence is really marginalizing and harmful to them when they see themselves, that's the title of that paper, like I'm nobody. People saw themselves being referred to as a potential offender or a possible shooter, and things like that. And that really had a profound impact, not only on their understanding of themselves and the world, but also, again, on how other people saw them and how they were able to move forward from their harm and their injury. So again, I think there's a lot of arguments for person first language, although I know it's a small thing, but I always like to name it. So finally, we only have a few minutes. So if we want to skip ahead, yeah. So narratives about firearm violence frame the problem through a criminal justice lens, obscure solutions, and leave out vital context. Those narratives may in part contribute to mean world syndrome, which stokes fear. Of course, they're also part of many much larger and deep-seated problems, which we all are, thinking about how to work towards. But in the meantime, as we're keeping the lights on, as we're interrupting mean world syndrome, as we're thinking about what we need to do next in that larger fight, we can draw on public health strengths, build partnerships with communities, and think about our language and values to help set the stage for a new narrative about community safety and health, which I know is such a priority for this group and for all the folks here. So, in closing, with our last few minutes, I want to elevate the couple of the resources I've shared. These are two of the resources from BMSG. I've written both of these, More Than Mass Shootings, gun violence narratives in California news. That's where a lot of the data I shared today is from. Some of the data is outdated. We do have an update that was published in 2021, and I'm currently looking for funding to do another update. So if anybody has any ideas, let me know. I also wanted to share Together is Where We Save Lives, also available on the BMSG website, which is a messaging guide that was developed over the course of 7 years for advocates working to reduce injuries and fatalities from firearms through community-led efforts. It is focused in California, but we interviewed and worked with folks from all over the country. And I think there's a lot of really robust learnings there that I hope will be of use. I also wanted to elevate colleagues and friends, as I've named the Media Accountability Project at Corners Research at Northwestern, as well as my friends and colleagues at the Philadelphia Center for Gun Violence Reporting, much of whose research I've shared today, and I'm privileged to be in conversation with them next week. All right, we have 5 minutes. I know that's not a lot of time, but I did want to leave space for questions, and I also wanted to profoundly thank you all for inviting me to be part of this conversation. This is an honor and truly one of the things I'm most passionate about doing. Um, Okay, so I saw a health department slide. Oh, yes, I'm sorry. I'm looking at the chat, but Michaela, I saw you come off mute.
Yeah, thank you so much for your presentation. As you mentioned, we have a few questions, so we'll go through them as quickly as possible. I saw one in the Q&A box first, so we'll go to that one and then the question in the chat. An anonymous participant asked, how does your work impact on policy discussion and legislative action, local, state, and federal? And if you're familiar with and dialogue with the 97% project? Pamela, you're on mute.
You know what? You'd think it was my very first day on Zoom. Um, so I'm not familiar with the 97% project. Um, I would say in terms of the first part of your question, I think it's a point really well taken. What I know is that our the way that our work kind of manifests in those spaces is people who use our data, right, to inform things like not only their advocacy, but in our cases, a lot of times their work with, for example, changing how newsrooms function. Um, for example, I believe, and I'm blanking on the name, Baltimore, I think it's Baltimore, has had some pretty significant impacts on, for example, reducing the incidence of use of mugshots in pictures in stories. I can dig that up. I don't have the data point on the top of my tip of my head at the moment, but uh, I wanted to name that that's somehow how the way our data works out, because again, a lot of the data that we generate has to do with media coverage. I would say also that one of the things that has been really helpful though in working with local folks is it helps give a sense of what the entry point for conversations about firearms is with local policymakers, and so they can start saying, okay, well then our solution isn't really getting any attention. So when we're trying to engage with a policymaker, we really need to make sure that they understand the nuances of what it is that we're trying to do, because they're not going to be getting that from their briefings with their PAs about what's in the media, for example. So I would say that that is one way. And again, I will definitely look up the 97%, the 97% piece.
Great, thanks so much. Amelia asked in the chat, how do we address the issue of underreported incidences of violence in Black and Brown low-income communities without contributing further to existing stereotypes and misconceptions about those communities? Really great question.
Yeah, no, and I'm really appreciative of that. I was looking at that question and thinking, gosh, that is a great question and one I don't have an answer to. And in fact, that's kind of why I wanted to name the dichotomy, the tension between the two pieces, right? That when stories are appearing, they are contributing to, well, I would infer that they are contributing to misconceptions about, for example, the prevalence of Black and Brown communities being involved in violence. And at the same time, there is this trend towards ignoring the actual incidents of violence and the actual shootings that are happening in favor of spotlighting what is happening to white and affluent communities. So the answer that I have is I don't have an answer yet, except that in my work, for me, it's really about trying to lift up that tension exists and support folks in their individual work in community, to whether it is to work with local reporters to broaden to broaden their reporting and improve their reporting about individual incidents, or whether it is working with large scale national organizations to ensure that when things are happening good and bad in low income communities and Black and Brown communities, those are generating attention and getting the coverage that they deserve, and getting robust and accurate coverage. I'm sorry I don't have a better answer to that, but I do think conversations like this are the start of how we document where the problems are and think about how we want to tackle them.
Absolutely. I know we're coming right up on time. I just want to make sure you saw some love that you were getting in the chat, specifically from Valerie on your presentation.
Oh,
Um, yes. And so
thank you. That's really nice to hear. I was I as I say, I don't love this topic because it is very hard, and it is upsetting that it continues to be, even 15 years into my career, something that I don't have answers to, that we're still t raising these tensions and questions. And yet it is something I am incredibly passionate about. I love being in space with folks who are thinking and talking about these issues and curious. Make sure to share these slides, my contact information, and any of the resources. And I would love to continue the discussion and think together about how we answer the phenomenal question that Amelia raised, but also many of the other ones that people have raised that we've just begun to scrape the surface of right now.
absolutely. We'll definitely share that information. To Dominica's question about some specific examples that cities, progress that has been made, we won't have time to delve into that now, but I would like to put in a little plug for the next part of this two-part conversation webinar series that we're hosting. It will be happening on October 8th at 12 p.m. And during that presentation, speakers will share their experiences of incorporating narrative change strategies into their work. So we hope that you're able to join us then. And as I mentioned in the chat, and I believe at the top of the hour, recordings from this presentation, the slides, and the registration link for that upcoming conversation will be shared via email within the next few days. Thank you all so much for joining. I see so many great things in the chat. I'm glad to hear that this was a great conversation. Pamela, thank you so much for your time and insights that you were able to share with us. And we will see you all later. Take care.
Thank you again for having me.
Thank you so much.